How much olive oil do I have a meal? Oh, maybe half a teaspoon a meal. I didn't have any this morning, but I know Teresa, the lady that made the lentils, and she would have put olive oil in the lentils because she's cooked for me many times over at Eden Valley. Sorry? Ginkgo biloba is great for memory, that is true. But what I wanted to address here in our lecture on the heart, I wanted to give you the truth on these areas, because there's so much misconception, and there are two systems of healing in the world today. One's based on fear, one's based on faith. And the one that's based on fear is based on a theory that we evolved. And because we evolved, we cannot heal. And because we cannot heal, we've all been trained on this system to go to the doctor and get drugs. But this system of drug medication is based on deception. I read a paper on a new cancer cure. 50% success. I read the fine print. 2 people were tested and 1 died. Yeah. This system is based on the fact that we were created in the image of God, and because we were created in the image of God, we have an incredible body that can heal. And if it needs a little bit of help sometimes, we've got herbs. Psalm 104 verse 14, God gave herbs for the service of man. This is the truth. And as Dan showed us very clearly this morning, the choice, that's a C. The choice is ours. Beautiful gift that God gave us is the power of choice. And if someone, it's like Jim came to me and said on the phone, he said, oh, Barb, I've got, build up in arteries. The doc wants to do a bypass. I said, and he said, and Mike says I should come to your retreat. What are you going to do? I said, well, we stop the stimulus, we get you walking, get you drinking more water. He said, oh, Barb, that's a bit extreme. I said, Jim, I'll tell you what I think's extreme. I used to work in the operating theatre. They get a saw, they cut your ribs open, they pull it open, they cut out the artery, they cut out an artery in your leg and sew that up. Poor old leg hasn't got that anymore. And then they sew it in your artery. I said, that's extreme. You know what his next comment was? Oh, yeah, Barb, but the specialist is such a nice guy. So what? And by the way, he should be. Huh? And any health professional that gets annoyed with you, you leave their office immediately. They have no right. They have no right. Anyway, Jim went with the specialist. Jim lived about another 18 months. And yet he could have lived another probably 20 years. But you know what? That's our God-given right, isn't it? That we choose what we do with our body.